Hello, everybody, and welcome to today's broadcast. Hello, everybody. So Brother Richard. Welcome, guys. I've not done a teaching for a long time, so it's sort of strange to me, but we are there trying to go live on all the platforms. So on my Facebook page, on the Health Gospel, and on my YouTube channel, which is the Health Gospel on YouTube. So you can go on there. You can go on the YouTube. You can come on Facebook, whichever you prefer. You can use it, whichever you prefer. And I need to get this, what is it called, off. Thank you so much. I'm back on the Health Gospel. And today we are discussing headache. It's very important that we talk about it. I mean, in the last couple of months, I've been really restraining myself from discussing lots of topics, and it's not good. I have to continue discussing topics because it's very important for us to create awareness. That's what the Health Gospel is for, creating awareness. So welcome, guys, and I'm going to go straight to the point. Please share this video. It's not going to be long. I want to be making really short videos, number one, because of people back in Africa and data problem. So I'm going to be making really short videos. And today we are talking about headaches. And the headaches, I mean, everybody knows headache is headache. Head is your head, ache is pain. So headache is headache. Headache is discomfort, pain in your head. So we have we classify them into two different groups. The primary headache, which is a headache that comes on primarily, they are simple headaches. Headaches like migraine headaches, headaches like tension headache. I'm going to describe or explain them. Headaches like cluster headache, and we have hormonal headaches. We have a stress-related headache. We have headache that comes from muscular pain, like you have neck pain or neck injury, and it sort of shoots pain into your head, and you have a headache. Now, we will be dwelling a little on both sides, which is the primary headache and the secondary headache. Most people say, oh, I have a headache, and we throw two paracetamols into the mouth, or we throw two ibuprofen into the mouth, and we say, oh, my headache is a bit better. I'm going to be discussing the red flags, what I ignore when you have a headache. I'm going to be discussing the red flags, things you should never ignore when you have a headache. So primary headache is migraine headache. So a lot of people suffer with migraine headache. Migraine headache classically comes on with an aura. So there is something that brings it on. And people that suffer with migraine headaches do understand what I'm talking about. It could be that they are stressed. When they are stressed, they bring on their migraine, or they are anxious, or they are constipated, or probably around their menstrual period, they have a headache. This headache is one-sided, so it comes on one side of your head. You can have pain when looking at light with this headache. You can have pains when looking at light with this headache. You can feel sick with it, but you might not be sick. You might not be vomiting. I mean, feel sick, I mean feel like vomiting. You might feel like vomiting, but you will not vomit with it. You feel sick. It can last up to an hour, 2, 3 hours, and then the headache goes away. Some people, the headache can last few days and it goes away. When it goes away, it goes away, and you're back completely. You're completely back to yourself. So it is one-sided. It can go into your eye. You can have problem looking at light. It hurts your eyes. You can feel like vomiting. Some people even vomit with it. It comes on different occasions. Maybe if you are constipated, if you are anxious, if you are around your menstrual period, or if you are stressed, it comes on. This type of headaches is called migraine headaches. Women have it more than men. The percentage of women that have migraine headaches are more than the men. We move on to tension headache. Tension headache are headaches that come like a tight band around your head. They come like a tight band around your head. It's mostly headaches that comes when you are under pressure, when you are under pressure to do something. Some people have that tension headache when probably at a job, you are given a deadline. Maybe in school, you're given a deadline, you're not sleeping, you're under immense pressure to submit or to do something or to get an outcome. You can suffer with tension headache. It comes like a tight band around your head. It could last for days and it goes away. I keep using the word it goes away. When it goes away, it goes away. You will not have it again for that time. We move on to cluster headache. I will write out all these types of headache on the Health Gospel page, and I will try to explain them in layman's terms. We move on to cluster headache. Cluster headache, the difference is it attacks one side of your eye. Your eye can become really red and painful. Your nose can become running or congested. It can last for days. It comes in cluster. It comes like a heavy rain on you. It's there. You are struggling with one side of your eye. It's very painful. You might feel there's something wrong with your eye. It's red. Your running nose or your congested nose. If that happens, you are having cluster headache. And when it comes in clusters. So you can have a cluster headache for a month, 2 months, in a year, and it goes away. You will never suffer it again for that year. Come back again. These type of headaches are more common with the what's it called? With males than females. With males than females. And then we have medication overuse headache. A lot of people take medications, ibuprofen, codeine, they take all sorts, steroids, prednisolone. You go into the chemist, they prescribe drugs for you, take it. A lot of drugs, their medication side effect is headache. So when you're taking this medication for a long period of time, their side effect is headache. So you suffer with headache. There are lots of headache that are hormone related. So during especially the female menstrual time, they can have headache and it goes away. We then move on to secondary headache. I want you to pay close attention to secondary headaches. A lot of people do not know the difference, so they carry on and they suffer. You hear somebody say they slumped and died. Secondary headaches are more serious headaches. Secondary headaches are headaches that can kill you. They are more serious headaches. They are headaches that can kill you. I don't know what's happening here. Secondary headaches are headaches that can kill you, right? And they are headaches that you should not joke with, okay? Secondary headaches we should not joke with. The first cause of secondary headache, okay, so these headaches are headaches that you wake up with. First thing in the morning, you wake up with this headache. Or it could come on suddenly, the most severe headache of your life. It comes on suddenly, suddenly. Very important. Do not make it light. This word, sudden, it comes on suddenly, suddenly. Very important word. If you have a headache that comes on suddenly, like somebody, the headache just goes from 0 to 20, is so severe. That is not a headache to joke with. That is not a headache to joke with. You need to go and get that headache checked. You need to go straight to the hospital to get that headache checked. The second type of headache is if you are going towards 50. Please listen to me, guys. If you're going towards 50 years of age, you never used to suffer with headaches before, and all of a sudden you start having headaches, brother, sister, you need to have that headache checked. What you need is a CT scan of your head. A CT scan in Nigeria, I don't know of Ghana or Zimbabwe or Congo, a CT scan of the head in Nigeria is 30 to 40,000 naira. That is not compared to the ashebi you buy every week. That is not to be compared to the things you buy that you do not need. 30 to 40,000 naira. If you are going towards 50 years of age, above 50 years of age, and you suddenly start developing headaches that you never used to have before, you need to get that headache checked. You need a scan of your brain. Number 3, you have a headache that comes on when you are exercising or exerting yourself. Example, when you sneeze, you have a severe headache. When you go to the toilet and you're pushing your poo to come out, you have a severe headache. When you are running, you have a severe headache. That type of headache is not to be ignored. You need to get that headache checked. I didn't say go to the pharmacy. I didn't say go to the chemist and get medication. I didn't say go and self-treat yourself. I'm saying you need to see a certified doctor, a doctor that can go through your history and tell you what you need to do. If you have a headache that comes with problems with your vision, so when this headache comes on, you are either seeing things double, or you are not seeing part of your eyes, you're not seeing part of your vision. So some people say, I cannot see you if you stand by my side, or I cannot see you if you stand on my left, like half and half. There are patchy things in my eyesight, I cannot see clearly. That type of headache is not to be ignored. It could be a cancer in your brain. It could be an infection. It can be a tumor that is growing and is compressing the pathway of your eye. That type of headache is not to be ignored. Okay, then you have a headache that comes, when this headache comes on, you other problems, weakness down one side of your body, and then it gets better. When you have this headache, you have one side of your body is weak, or you have a seizure, or something that is not normal. Your body will tell you, don't ignore that headache. That type of headache should not be ignored. So I'm going to give us the red flags. What should I be worried about? What should I be afraid of? What should I not ignore? Number one, a sudden onset of headache and thunderclap headache, the most severe headache of your life. Don't ignore it. Do not ignore it. Number two, positional headache. Headache that comes on probably when you stand up, when you are lying on bed, you stand up, or you are sitting down and you stand up and you have a sudden headache. Please do not ignore this headache. Do not ignore this headache. Number three, you have a headache when you are exercising. When you're doing something strenuous, the headache comes on pounding, like pushing your head off. Do not ignore this headache. Number four, a new headache in someone who is going close to 50 or above 50. You never had headache before, you start having headache, or you are having headache, you're losing weight without trying you to lose weight, but you are losing weight. Do not ignore that headache. Do not pray away that headache. Do not even put anointing on that head. You need a CT scan of your head. You need an imaging of your head. You need to see the doctor. Number five, changing the pattern of your headache. So, for example, you used to have headaches once in a month, or just maybe when you are on stress, you have a headache. All of a sudden, you start having headache every day. That's a change of pattern in your headache. Or you used to have a headache one side of your head, you know that's my migraine coming on, and then you take your migraine medication and you're okay. But this headache has changed pattern. It's no more one side of your head. It's no more responding to medication. It's just severe headache. Please do not ignore this headache. I'm going to mention then a headache that does not go away. You've done everything, it's not going away, it's there. Headaches are symptoms. Your body is telling you something is not right. It's not right up here, do something. Or you've got an infection, or you've got eye pressure in the back of your eye, because that can lead to blindness. It's called glaucoma. If you have glaucoma, sudden onset of severe headache, and your vision is gone, do not ignore it. Do not think it's a spiritual attack. It's not. It's an illness. It's sudden. It's an emergency. There are lots of good eye doctors in Nigeria right now. In Africa and Ghana, you have brilliant doctors. Let it be, need to keep this money and buy. If I don't buy this uniform, I'll be the only one, odd one out. Be the odd one out. Because without your health, you cannot wear ashebi. Without your health, you cannot go for parties. Keep that money and go and check what is going on with your brain, with your head. Keep that money and go and check what is wrong with you. Let us keep our priorities right, because we've lost what priorities are. We chase after shadows. What can cause severe headache? Why do I call them serious headaches? Number one, meningitis, which is inflammation of the lining of your brain. Number two, layman word, cancer of the brain. Those cancers can kill. If they are not, even when they are picked up early, they can kill. Tumors are like growth in your brain. They keep swelling, they keep growing. When they grow and the brain needs space, when that growth takes over the space of the brain, and presses any important center of your brain, you can die. High blood pressure. So there are people that have very high blood pressure. You have a headache. That headache comes at the center of your head here. It's beating you here. Hypertension. The headache is beating you here. You feel pulsating headache. What is pulsating headache? It's as if something as if something wants to pump out of your head. Go and check your blood pressure, because the next minute you're going to be slumped and dead. Go and check your blood pressure. Blood pressure medicine are not expensive. Blood pressure tablets are not expensive. It is better to prevent than to go and look for cure. When you have a stroke and they are calling 1 million naira and you don't have it, it's better to prevent the stroke than to have the stroke and then you are going everywhere. Look yourself. Look, my mother used to say, look for a black goat when the day is still bright. You cannot look for a black goat in the dead of the night. Goat is black, night is black. How do you find the goat? It's the same with our body. Take care of your body when it's early. If you have symptoms and you have a ceremony coming and your body is having severe headache, pause the ceremony. Stop. Tell your body, stop. Stop pursuing a shebi. Stop pursuing ceremony to go and take pictures and put on Instagram and Facebook. Check up. Take yourself and go and check up. Take yourself and go for checkup. Take yourself and go for checkup. I'm repeating it again. One don't have to wait till when it happens. Then your family will be running. They can't even open your phone to get your bank details. They don't even know who your bank officer is. It is a mess. But you knew that you go to that one bed. You are having a banging headache here. Your blood pressure is pumping. The headache is pulsating, is pushing. Your friends are saying, are you coming? Are you on your way? You say, I'm here. You're doing, what do you call it? Macho. You go to the one bed. They are playing music. You're dancing. Your head is pounding. You know, you're feeling dizzy. He's going. You're still there doing. There is no spare body part. There is no spare life. There is no spare life lying somewhere that they will come and carry and give to you. Life is only one. For you to achieve all your plans, this body needs to be healthy. Whatever you want to achieve, this body needs to be healthy. This body needs to be fit. This body needs to be well. Before you think about the frivolities, think about your health. Think about your health. If you're having a headache with fever, with vomiting, you take paracetamol. You take tablet to stop the vomiting. You take all the take. You have not cured yourself. You don't know what is causing the headache. I say to my patient, I don't know what is wrong with you. It doesn't make me a bad doctor. It makes me a good doctor. I cannot just give you things to make you happy. I want to know the root of the problem. I want to know what is wrong with you before I can say, okay, this is what we need to do. So lastly, every headache that is abnormal that I've mentioned, you need to scan your head. You need to go and see the doctor. You can't just go and scan your head and carry the result and put on Facebook. There's nothing you will not understand what is on that paper. So you need a doctor to send you to have a scan. And then you need to sit down and ask the doctor, what is on the scan? Can you explain in layman's terms for me? What does that mean to me? You need to ask those questions. Scan is 30,000 to 40,000 naira. MRI scan, which is the highest form of scan, is 60,000 to 80,000 naira. I don't know how much is it in Ghana. Don't know how much is it in Zimbabwe. I don't know how much is it in South Africa and all that. But Nigeria, 60,000 to 80,000 naira. A CT scan of your head, which can also give you lots of information, is 30,000 to 40,000 naira. That money, you can have it. If you are in this category that I've mentioned tonight, please stop saying, I believe that God will heal me. Stop. I don't even want to go there. Stop saying, God take it. It's not God that took your life and left your young children. Stop saying, my pastor said. It's nothing to do with that. Those are mere words just to collect your money. If you're in this category that I've mentioned tonight, next week, Monday is from tomorrow, get yourself checked. If you have any questions, come to my inbox or write it on YouTube. Wherever you want to write it, let me know the pattern of your headache so that I can advise you. Explain the pattern of your headache to me so I can advise you. I have migraine headaches, but mine is diagnosed formally. I had an MRI scan of my head. They made sure nothing else was happening in my head. They looked at the pattern of my headache before they gave me the diagnosis of migraine. Do not sit in your house and give yourself diagnosis. I have migraine. Every time somebody calls you, you say, this my migraine has come back again. How do you know that it is migraine? How do you know that this headache is migraine? How? You don't know. Stop telling me, doctor, you don't understand. It's very expensive. Healthcare is expensive. Go to America. You pay up to $9,000 for healthcare. You pay through your nose. Ask the people that are living in America here. They will tell you. Ask the people living in America. I know people here that are living in America. Stop telling me, Nigeria, government. You take your money. You buy rubbish. You take your money. You feed rubbish. You take care of your health. Okay, isn't it? Is asking me to repeat the categories of the headache. I talked about primary headaches. Primary headaches are very common headaches. I'm just going to be very fast. Migraine headaches, tension headache, cluster headache, medication overuse headache, headache that comes premenstrual headaches, all those sort of headaches are primary headaches. We go to secondary headaches, which are headaches that are very serious. These are headaches that come like thunderclap headache, severe headache, sudden headache. You've never had this headache before. It hits you like a baseball on your head. It hits you hard, or it comes suddenly, or a headache that wakes you up in the morning, you vomit, loss of vision or part loss of vision, or you're seeing double vision. These type of headaches I'm mentioning lastly, they are not normal headaches. Or a headache that comes when you are exercising, or you're having sex, or you're coughing or sneezing, you have severe headache. Those are not normal headaches. Or the headache that comes on when you are going towards 50 or above 50, you never used to have headache before. All of a sudden, at 50, you start headache. That type of headache, we always scan the head. We always scan headache before. You've never had a diagnosis of migraine or tension headache or cluster headache. All of a sudden, towards your 50 years of age, or at 50 or after 50, you start having severe headaches. A headache that change in pattern. So maybe you used to have migraine headache. All of a sudden, you are not having that type of headache anymore. You say this headache is different. You know, this headache is different. I think this is different. It's not the same. Please do not ignore that headache. It could be cancer. It could be a benign tumor. A benign tumor is not cancer, but it can still kill you. It could be an infection. It could be hypertension. It could be a high pressure in your head, which is called intracranial pressure. It happens in young people. So don't say because I'm young, I'm having headache. It's okay. It's not okay. You can have high intracranial pressure, which can lead to sudden death. If you are having headaches that you don't understand, please inbox me. If I don't answer today, tomorrow, 3-4 days, I will respond to you. Explain the type of your headache. I will tell you what to do with it. Thank you so much, guys. Next week, I'm going to treat another topic, which is sudden death, slump, all this slump. I'm going to treat another topic. I forgot the headache that comes with weight loss or stroke-like symptoms, or you feel like one side of your body is weak. This headache, this is an attack of the devil. The first thing you do is to carry your papa's oil or sticker. Please, please, please don't do that. That's a severe headache. That needs a scan. That needs investigation. I say it, and I'm saying it again, that it is easier to treat what is not yet killing you, that when you're lying down there and you're going, people are running up and down, time, we need to raise money. That thing doesn't work in Africa. It doesn't. Please let us prevent, let us protect, let us treat ourselves early. Please. Thank you so much, guys. Thank you for your contributions. Thank you for listening. I wanted to do 30 minutes just because of data of people back home. They need shorter videos so that they can share it. They can push it out so that people can benefit from it. So thank you so much, guys. Thank you. Please go and subscribe to the YouTube channel. It is on page and I'm live on my page. If you haven't subscribed to the Health Gospel YouTube channel, please do, because we will be broadcasting on all the platforms from now on, and we will be treating very important topics. Thank you so much. If you have any questions, please inbox me. I will answer you. Thank you and bye for now.